So without further delay, let's dive in. So the reason why you're here with us today is because you probably saw one of our social media posts, or maybe you were sitting in a conference somewhere and you saw this tree pop up and really wanted to learn a little bit more about why it was developed and how it's being used. And so the PARe Aces tree we developed early on in our work here at the Building Community Resilience Collaborative to find a way to effectively not only talk about the problem that we're trying to solve, but help others see themselves in the work. And that's really a fundamental strategy that Sarah will talk about later here, but really it's not enough to just educate people with regard to understanding adverse childhood experiences, but also helping them to understand the context in which these things occur so that we can begin to think of holistic strategies as well as solutions that go across generations. And so again, what the analogy with the tree is looking at the adverse childhood experiences, thinking about those things that we can see from the eye. So much as you would surmise the health of a tree by looking at its branches and at its leaves, whether they're green, whether they're falling off, or the branches appear to be sturdy or their branches appear to be weak, would give us an idea of how healthy that tree may be. What isn't necessarily obvious is the soil in which that tree is planted very much informs how well that tree will be nourished. And so when we think about that in the context, again, of these PARe Aces, we look at the soil that is nurturing that tree. And so whether that is a community that's planted in concentrated levels of poverty, high levels of discrimination, lack of social access, as well as access to capital and economic mobility, or even the housing quality. Now, I want to say that with this tree, we've had a lot of input from communities to say, well, what about, adding historical traumas? What about adding, something that was much more contextual for our community? And we say, hey, go ahead, add it. This is not meant to be a completely full list of what the adversities could be. And again, that's why we started with just this list, but we've worked with partners who have personalized or contextualized this to really work for their audiences. And so we certainly encourage you to do the same. This, again, is meant to be a tool that starts a conversation, but not to be something that's prescriptive. So, again, making sure that you personalize this. And so what you'll learn is from today is how our communities across the country have been using this tool for the last 3.5 years. So BCR is being implemented in 5 communities across the country. We started in cities, and some of them have become state-level networks. It started in Portland, Oregon, and has spread to a statewide initiative with a number of different partners there. We are also in St. Louis and Kansas City with the Alive and Well communities that spans the entire state, as well as several counties in Kansas, as well as in southern Illinois. We're also in the Cincinnati-based team, the Joining Forces for Children Coalition, of which you'll hear Carolyn Brinkman speak to later, that spans southwestern Ohio, northern Kentucky, and southeastern Indiana. And of course, we're here in the nation's capital in Washington, D.C., working with a number of different partners across the district here, which also serves as a city and a state. Just a little bit of trivia and reminder there. And then, of course, we're in Dallas, Texas, where we're very excited about the fact that multiple cities across that state are now looking to join forces with the team based in Dallas. And I will also point out to you, as you hear more and more about how BCR operates, you'll see that we have no limit on who can have a role in this work. And so we work with community organizations, but in Dallas and Washington, D.C., we also are embedded in city government. City of Dallas is an active partner, a co-creator of solutions, working with the team there around their goal of creating a more equitable city. And in fact, the city adopted a title of a goal around an equitable city is a resilient city. So, we're looking to city leaders as well as being a part of the solution and co-creating with community. So let's talk about the process. What exactly is BCR? Why do we have these tools? And how does this all work? So BCR, at the fundamental point, is really an operating system. It's not meant to be prescriptive, and it's certainly not a stepwise fashion, but it is based on 4 main components, and that is creating shared understanding. And really today, we're going to spend a lot of time talking about the shared understanding piece, because these tools were really developed to help bring partners, cross-sector partners, multidisciplinary partners to the table to create a fundamental understanding of what is the problem that we're trying to solve. And so through that, you get the narratives of the community, which is a very important piece of this work, making sure that the community is at the table, those individuals of which we aim to serve, and as well as the solutions that we aim to create, those individuals are actually at the table and helping us address those things. And so, of course, as you've heard me say over and over again, if you've ever been to our website, you've seen how this is so dependent upon having these cross-sector partners, making sure that we know how to connect, where our resources are distributed, as well as understanding our state of readiness. And so a lot of times our communities are doing the state of readiness, bringing cross-sector partners in almost parallel to one another as they realize that there's a need that needs to be addressed, but those that are assembled at the table just can't necessarily address that, and there's a missing partner. That's how our circle widens and grows, and that's how we get the resources available, but also thinking about from a long-term sustainability perspective, the more partners that we have at the table, the greater the opportunity there is for longer-term sustainability of the work. So again, these 4 components are all conducted simultaneously. We don't tell communities how to do this. We help them do this work. We work with identifying the partners and providing the tools and resources. And so today's webinar is really showing you some of those first tools and how they've been applied that we've created. Our first tool was the Coalition Building and Communications Guide, and with that was developed the PARe Aces tree, really around that first component of creating a shared understanding. Our second tool that we came out with was the Policy and Advocacy Guide that was introduced earlier this year. And all of these pieces fit together. So you can see there on the left-hand side how those pieces can fit together to accomplish a number of different goals that you may have with regard to your shared understanding, but also coalition building piece. And so with that, I'm going to hand this over to Sarah Baldoff, who can talk about that fundamental strategy. Sarah?
Thank you, Wendy. Hi, everyone. I'm Sarah Baldoff. I'm the Director of Communications, Outreach, and Engagement here. And we are going to focus in a bit on one of our fundamental strategies, as Wendy said, and that is helping potential partners see themselves in the work. And a potential partner could be an individual, say a parent, a group of parents, a faith group. It could be institutions at the governmental level. It could be a public school system. But the idea here is that underpinning this work is making connection and making it easy for individuals in different sectors from different experiences and lived experiences can see themselves as playing a role here in this work of resilience. And so I'll go back here to the tree. And really this is a bit of a foundation. As Wendy mentioned earlier, we have sort of watched in awe in some cases as we've seen this tree literally take on a life of its own. It's traveled the internet, it's shown up in presentations, certainly our own, but also on the part of others. And what this has said to us is it really does resonate, and this framing of adverse childhood experiences in the context of adverse community environments really does sort of cut through. It is a signal in a sea of noise, if you will. And so what we like to do here is not only present the original PARe Aces tree, as you see, but also, as folks will later explain, how they've adapted and adopted locally, but we are introducing a new infographic that you can customize later. So as Wendy pointed out, part of the process here is this shared understanding, and that's another fundamental element here. Meant to be open, flexible, but the foundation is around meeting folks sort of where they are. Listening is essential here. So understanding in your community what are the specific ACEs, the adversities that individuals, families, children are facing, but also really starting to explore and understand the elements of resilience that are already there. And we know in this work that regardless of what may appear to be a very painful or difficult either, say, neighborhood or environment, there are always elements of resilience. And that, too, similar to the way this PARe Aces tree has traveled and the uptake has been significant, is people really respond to this concept and sort of ultimate truth, if you will, that there's always sources of strength. And so to tap into that and keep that on the table in these conversations is key. And so finding these things out and sort of mapping out the story or narrative begins with community, really, and understanding what their narratives are, what the historical experiences are, what the current and new experiences are. So you'll see that here, right there, the ACEs, resilience, and narratives of the community are elemental to the shared understanding. And then we'll go into building coalitions for change. And you can see that at the base here is the PARe Aces, and on that you sort of build this shared understanding. And then the narratives of the community are developed or sort of sussed out from that shared understanding. And then you begin to develop your messages, and we'll refer to this sometimes as asks, what you're looking for, what you're hoping to change. And this all comes to the elements of a strong coalition. And as Wendy pointed out, partnership and coalition is, again, fundamental to this work. And again, pointing back to our fundamental motto, if you will, or one of mine at least, in communications, is helping people see themselves in the work. And when you have these foundations, you can begin to see change and begin to move change forward. So here up on the screen, you'll notice a lot of bullet points, and all of this and much more is in our communications, our coalition building and communications guide. These are highlights, I should say, in talking about the PARe Aces, because it is potentially very painful, actually, to discuss these traumas that have sort of beset either an individual, a family, a child, or a community as a whole. But there are ways to do this, and we have watched our teams do it. You'll hear from several of them later in the call. But it's critical, just fundamental communications is really trying to understand your audience and do some homework ahead of time. If you're going to take a meeting, you know, the internet is a beautiful place sometimes. It can teach you a lot about where individuals come from. Folks are very comfortable these days tweeting out, you know, photos. There's media that you can read, but really getting a sense, background of where people come from. Being clear and concise, of course, fundamental golden rule. And one thing that we talk about a lot here is using stories to personalize data. And Caitlin on our team will talk a lot about data in a bit and how to display it in our new infographic. But the two, we think, should always go together, because stories are really a point of connection. It's how people, again, see themselves in the work. There's something relatable about that human connection. Data really makes it more rich. It kind of can describe the scope of a challenge or a scope of strength sometimes. And the other thing to note here in talking about the PARe Aces is to avoid jargon. This is the type of, this comes down to language, and this is about whether or not you actually see someone connecting and, you know, their eyes lighting up or their eyes glazing over. And sometimes this can be sort of misinterpreted as dumbing things down, but in fact, I think it's more about remaining accessible to all parties. And really, again, the foundation of this work is developing a strong and diverse coalition. So you're going to have to, in some cases, bring it down to the elements and where do you intersect. Again, describing and illustrating the work as opposed to just telling people, show them what you're doing. And then again, later in the coalition building and the communications guide, there are lots of tips and tools for helping you develop what we call the ask. And Jeff Hild on our team, our policy director, will describe a bit more about what an ask is, specifically for a policy audience. But in plenty of instances, you are asking individuals to partner with you, and even that alone is an ask. It's a request. It's a invitation to connect. And again, we have these tools that help you identify barriers to avoid sort of landmines, identifying individuals' values, and this is, again, another place to connect. The idea here is that you'll craft a collective vision and really develop tools, connectedness that will strengthen and nurture that soil that we're growing and planting the trees in. And I wanted to give an example here of a Washington Post op-ed that came out just at the end of last year. We've had a number of challenges in our education system, and this particular op-ed was written by the valedictorian of a school, a high school here called Blue. There was a scandal that popped, if you will, in the media about students that were being graduated, that when it came down to it, the realization was they weren't attending class, they had been marked absent, and so it really opened up sort of a multi-month conversation in Washington, D.C. about what was going on, not only at this high school, but several other high schools. And this, along with a social worker, Litzy, the valedictorian, has written an op-ed. And you'll see here, she writes in one of these, in the piece, Bellew, in this Congress Heights neighborhood, they're confronting structural racism, systemic oppression. They are talking about existing in a community that is in crisis. They're facing housing instability, food insecurity, and trauma associated with chronic neighborhood violence. And so these are the elements in the soil. This is the tree is planted in this environment. And you'll see up here at the top, she points to how am I going to succeed academically if this is the environment in which my student body is growing. And again, that is seeing the PARe of Aces in the media, in the common conversation that's going on in certain places in the city. We're lucky that she actually wrote this op-ed because now we can see broadly, there are plenty of people in the community in this high school, teachers, social workers that know this. However, seeing this in the Post is quite a launching period, place for a conversation like this. And this sort of leads to multiple ways to communicate around the PARe of Aces. Certainly you can do it one-on-one, but here this is a sort of a snippet from our testimony that we submitted before DC Council, because they took up in the Committee on Education this issue of absenteeism based on the Bellew High School situation around graduation. So you'll see that part of what we'd written is that trauma impacts how children learn and behave in school. And there's quite a bit of science to back this up. And you'll see many resources on our website and our Twitter feeds and other channels where you can find information. But this op-ed, this scandal around adversity in the community showed up in district council. And here, this is another way of communicating around the PARe of Aces. This is Chairman Grosso. He is the district council's chair on the Committee of Education. And he held a hearing around his fair access to schools legislation that really came out of this scandal around absenteeism. But as we know from the valedictorian's op-ed, this is really, the scandal is more of an outcome that we could have predicted, as Wendy described in the soil and the PARe of Aces. And as the valedictorian eloquently said, this is a community in crisis, and how can you expect our outcomes academically to look the way you want them to look? We need a supportive community, which is where the PARe of Aces and BCR comes in, as well as the process. So I will end there, and we'll shift to our MoCan team. They'll introduce themselves, but Vaughn and Sean from Alive and Well Communities, hopefully you're on the line and can tell us a bit more about what you're doing and how you're using the PARe of Aces and localizing it for the communities and neighborhoods where you are.
Thank you, and we are here. We're really excited to share with you how Alive and Well Communities has had the opportunity to use the PARe Aces across all of our work, across all of our initiatives. I primarily oversee our training and technical assistance aspect of Alive and Well Communities, and so I wanted to really start by sharing with how we've used the PARe Aces as an education and more specifically as a training tool. Can we go to the next slide, please? So here you see one page out of our trauma awareness slide deck, which is our introductory training to trauma, helping people understand and build a common vocabulary around trauma, understanding the science and research, being able to look and understand the impact of trauma as well as a call to action. Now, what I'll share with you is that the PARe Aces is something that we not only use in our introductory training, but it's also a tool that has been highly successful across sectors, whether it's healthcare, education, social services, criminal justice, as well as in our local community trainings. And I also wanted to share that then in our deeper trainings that we do with organizations, the PARe Aces really becomes central to this understanding as we think about then what is our call to action? How is it we build trauma-informed, whether it's communities, environments, or organizations? So if you'll go to the next slide for me. So what we were finding is that we've always talked about environmental and community trauma in our trainings. But what we really learned from having discussions with those we've been in contact with is that people really walked away with this understanding that when they thought about the impact of trauma, they only thought about those 10 core ACEs, those adverse childhood experiences. And so regardless of how we talked about community trauma and trying to really make that connection, what we found is that people just weren't really understanding the true impact of community trauma. So then when we changed our slide deck, and you can go to the next slide for me, this visual and this metaphor really helps people to understand that it's not just what's on the surface in terms of those interpersonal experiences, but we have to understand the soil in which our community is rooted, understanding those toxins in our soil, and understanding how they impact the health and well-being of our communities. That if we truly are looking to build alive and well communities, we have to be able to name the trauma that's impacting our communities. And we have to start to really think beyond just those adverse childhood experiences and think about those adverse community environments. So if you'll go to the next slide for me. One of the things we do after really talking about the analogy of the PARe Aces, we open it up to the audience and say, okay, you see really kind of a very general list. As we think about our community, as we think about our soil right here, what is it that's in our soil that's either listed and needs to be expanded upon, or what's missing from our soil right here in our community? And this really provides a rich opportunity for people to think differently and think more specifically about what's impacting our community, whether we're here in St. Louis, Kansas City, in Kansas, or somewhere in southern Illinois. We find that this provides a really rich dialogue for people to engage in the conversation and make those connections. And I'll share with you, one of the things that's been really interesting is that regardless whether we're in an urban, suburban, or rural area, what we're noticing is that the toxins in our soil are really very, very similar. Some of the things we hear are the policies that are creating space, whether it's the fiscal policies, whether it's the social policies or those political policies that are really creating space. Also, often we hear that discrimination, really people get very nuanced with this, wanting to really name all of the inequity that we experience in our communities. And again, we see this whether we're in a rural, suburban, or urban areas. Often, this gives people an opportunity to voice and really talk about not just discrimination in a general sense, but start to talk about the racism, the sexism, the transphobia, talking about the ableism, talking about all the various forms of discrimination. And the other thing that's really interesting for us here in Missouri is that a lot of times people want to list substance use not just as an adverse childhood experience, but they also want to talk about what is the community impact of substance use, so often wanting to also pull that down into the soil, especially here across our state as many states are facing across the country. We see that the opioid epidemic has reached really pandemic levels in our community, and really making the connection to what's underlying the substance use in our community. And this really becomes that rich tool for dialogue and discussion. As was mentioned earlier, I also want to talk about how the PARe Aces then becomes a tool to talk not just about interpersonal trauma, not just about those adverse community environments and the community trauma, but really becomes a platform for helping audiences across sectors and within the community really start to be able to have that difficult conversation about historical trauma, and recognizing not just the national narrative of historical trauma, but recognizing that in addition to that national narrative around historical trauma, there's also layered on top a community narrative of historical trauma. And so this really provides that springboard to really have that conversation and even move the conversation deeper beyond historical trauma to talking about what is fueling the historical trauma and sometimes the ever-present trauma, and really starting to understand the systemic oppression that's underlying this. So with that, I just want to share that think about this tool also in terms of not just education, but really in training and really bringing audiences to a place where they're able to have deeper conversations about really the root cause of trauma.
You can go to the next slide. So we have a process within our organization that we refer to as Build, Connect, Activate, and it's an ongoing process as we begin to deepen the knowledge or understanding of the impacts of trauma and toxic stress in our communities. As Sean mentioned, we use the PARe Aces in our trauma awareness trainings, which are monthly trainings open to the community. But we also have over 300 ambassadors, which are community volunteers, and we put them through an orientation that's 2 hours long. And in that orientation, we are now using the PARe Aces to really frame up the understanding of both individual and community trauma and to build that common language and understanding. We also have 2 steering committees, one in the Kansas City area and one in St. Louis, and we've introduced the PARe Aces to them as they begin to action plan and identify how we want to begin to address the issues that are showing up in our soil, but it provides a visual for them to kind of better understand that. And then Sean mentioned the different sectors of work. He did not share that he also oversees learning collaboratives both in the justice and health sector, and he has introduced the PARe Aces to professionals in this area so they can start to think about not just the individual experience with trauma, but how community experiences and environmental experiences affect both how they show up as institutions and how individuals interact with them. Next slide, please. So here I wanted to include a visual of what's in our soil in St. Louis and some of the Kansas City area. What you cannot see here is that our numbers are higher than the national numbers in these categories. I like to include this in our trainings when we are talking to folks about the PARe Aces so they can truly see some of the things that are affecting our soil here locally. But what's also really cool is that I can show this to folks, as Sean said, that might be in rural Missouri, might not be able to relate to St. Louis County or St. Louis City, but they can begin to look at this, and then I can ask them what is in their soil. So this is me exposing what we have going on in our city, in our region. But if you think about the PARe Aces, what's in your soil? And when I ask that question, it can be for them to think about community, it can be for them to think about neighborhoods, or what I really like is when organizations have to deal with the question of what's in their soil as an organization that can be affecting their staff and the people that they serve. Next slide, please. So here's just some examples of impacts from these conversations and using the PARe Aces. I think it really highlights community trauma. We spend a lot of time in the past talking about individual trauma and those adverse childhood experiences, but I think the PARe Aces really draws attention to community trauma. It encourages difficult conversations, especially when we ask that question of what's in the soil. It also identifies commonalities, which Sean spoke to. I can say with my own self and going into some rural communities, I went in with some perceptions of what may have been in their soil, but in doing workshops and talking to them and using the PARe Aces, found out that we had a lot of things in common between our rural communities and our urban areas in our region. It also exposes inequities. There's no way that you can really talk about what's in your soil without getting the inequity. And then from that, it advances conversations around equity. Next slide, please. And so what's next for us? We will continue to use the PARe Aces because we love it. We will continue to connect it with our process of Build, Connect, Activate. We will use it to continue to build an equity lens here in our region, to further engage stakeholders in action planning. That's specifically our steering committee. As we're looking at our soil, what can we be doing to change it? And then developing a policy agenda, which we're really excited to get into. Next slide, please. And so this last piece, these are the principles of trauma-informed care that we use from the Missouri model. But what you see going across this image is equity. We at Alive and Well decided to add that word to these principles of trauma-informed care, and I think using the PARe Aces really helps us to kind of defend that you cannot do trauma-informed work without looking at equity, without working towards equity. And so that is all for us. Thank you.
Thank you so much, Sean and Vaughn. We'd like to move next to our Caitlin Murphy here at GW Building Community Resilience.
Hi, thanks, Sarah, and good afternoon, everyone. As Vaughn just mentioned a little bit earlier, she showed what's in the soil in their local St. Louis County and city context. And this was actually a snapshot of an infographic that the BCR team here at George Washington University created for all of our teams that they've been using for coalition building, education, connecting more deeply with their community, and for policy and advocacy work. So I first wanted to, before I dive into the actual infographics themselves, talk a little bit more about why we even wanted to create an infographic in the first place. The PARe Aces tree, as Wendy and Sarah, Vaughn, and Sean have all mentioned, has been incredibly effective at engaging folks in this work. However, in addition, we've been hearing from our teams that visuals in particular have been very powerful in helping people understand what can be very complex issues, ACEs and resilience. We've also heard from our teams that the PARe Aces tree has felt even more powerful when paired with their own community data, and that they really wanted a way to visually display their community data in a meaningful way to accompany their personal community stories. And last, as we've been in conversations with our teams, we've wanted to lift up the power of not only telling adversity stories, but resiliency stories on the same document, so that it aims to show not only the challenges a community experiences, but their strengths and their potential opportunities. So, hearing this from our teams, we went about pairing local adversity data to the PARe Aces image. For example, here you can see on the first page of an infographic for Kansas, you'll see up at the top that we included the prevalence of children in Kansas and 2 counties in Kansas of children having 2 or more ACEs, and then the prevalence of several individual ACEs, such as children experiencing economic hardship, children living with an adult with mental illnesses, or having a parent who's incarcerated. And all of that is shown within the tree's leaves. Beneath the tree, the state and county level data shows how nutrient-rich or nutrient-poor the soil is for supporting the tree's growth. And this part of the graphic features several fundamental community stressors: the rate of community violence, the percentage of children in poverty, the percentage of homes that are considered severely unaffordable or unsafe, the percentage of families with limited access to a grocery store, and the rate of drug overdoses within the community, harkening back to what Sean was saying earlier about the environment where there's quite a bit of drug overdose going on being just as much of an adverse childhood experience as an adverse community environment. The next section on, I'm sorry, I'm just going to go back for 1 second. So this section in particular is highlighting the unique adversities within each community. For example, the poverty, grocery store access, affordable and safe homes, and violence we see as a particular challenge within Wyandotte County as compared to Johnson County and the rest of Kansas. However, we also see that Johnson County has its own adversities, high rates of violence, and actually higher rates of drug overdoses than its neighboring counties. The idea is that once these contexts are set up, readers can then flip the document over and may already then be introduced to various nutrients which can enrich the soil. In many communities, several of these may already be in place. The percentage of children who have a medical home, the percentage of families with consistent access to good nutritious food, the number of school-based healthcare centers with mental health services, the amount of steady job growth that's occurring over time, the percentage of workers with less than a 30-minute commute, and the percentage of families who are spending less than 30% of their income on housing. This side of the infographic seeks to highlight the community strengths while encouraging ways to continue to enrich the soil and the community environment, which we know can create a network of thriving, connected systems and supports for families. These environments can then grow supportive, healthy children and adults, which we know yields the outcomes we're all looking for: fewer youth in mental health crises, reduced crime, fewer justice-involved youth, fewer children in foster care, and families being able to draw on their strengths. Overall, we've heard from our sites that this infographic has been very effective at communicating some fairly complex topics. And what's been interesting to us is that while we received quite a bit of demand in the field for a customizable version of this infographic that then communities could insert their own local data into. So we're happy to announce that as of today, we've launched these customizable infographics on our website, go.gwu.edu/BCR. And you can specifically see the link for this template in particular, go.gwu.edu BCR infographic data. At that link, you'll find 2 fillable PDF forms which allow you to insert your state and county data. Currently, up to 2 counties can be inserted. And while we welcome you to modify all of the data points with your own community and state data, as well as switch in any data points which may be particularly of relevance for your community, we do ask you to just please keep the BCR copyright language at the bottom of the document. To then help you fill out these infographic templates, we've also put together a guide. In the guide, you'll find an overview of how the infographic has been used among different audiences, but more importantly, you'll find a state and county level data sources for each one of the data points in the infographic. In particular, we've tried to highlight interactive, user-friendly data sources such as county health rankings or community commons, as opposed to raw data sources. The guide also points you in the direction of the methodology which was used to generate county-level ACEs estimates on side 1 of the infographic. This methodology was developed by the Child and Adolescent Health Measurement Initiative, or CAMI, and pairs state-level ACEs data from the National Survey of Children's Health, which can be found at childhealthdata.org in an interactive data query, with American Community Health Survey data, which can be found right on the census's website. For the remainder of the data on side 1 and 2 of the infographic, we've linked you to various interactive data sources, which allow you to pull state and county level data points right on websites such as County Health Rankings, Community Commons, the Food Environment Atlas, etc. And last, before passing off to Jeff, who's going to highlight how the PARe Aces tree has been used in particular for policy and advocacy work, we also wanted to point you in the direction of a second infographic we created. This version of the template allows users to insert policy asks on page 2 of the infographic. Policies that they suggest to policymakers can enrich their community soil and build community resilience. Most recently, our BCR sites all modified this infographic and brought copies down to their representatives on Capitol Hill, which Jeff will touch on just a bit more. And with that, I'd like to turn it over to Jeff Hild, our policy director.
Hello, everyone. This is Jeff Hild. As Caitlin mentioned, really excited to be here with you all to talk about how we use the PARe Aces tree and kind of the idea behind the PARe Aces in our policy and advocacy work. Go to the next slide. So most of us realize that making the system level change that is needed to address ACEs and build and sustain healthy and resilient communities is going to involve policy change. And all of our teams, as you heard Vaughn allude to, have identified policy and advocacy as a primary component of their sustainability strategy. And I would imagine that most of you on the call are somewhere in that same boat. But despite this identified importance, policy and advocacy work is often intimidating, confusing, and frustrating for those not engaged in it on a daily basis, and even for those of us who are, especially for those of us who work in DC on a daily basis. The PARe Aces concept and the PARe Aces tree are really useful tools to help you build your policy work, grow, and sustain it. So I want to cover a few areas in the time that I have. First, I'll talk about how we use the tree and the PARe Aces concept to educate policymakers and lawmakers. Second, I'll talk about how the PARe Aces can help you effectively identify key partners and voices and go about building necessary partnerships and collaborations for your policy work. And relatedly, I'll talk about how the concept behind the PARe Aces can help you to create buy-in within your own organization and help you to visualize how you might fit into the work. And finally, I'll discuss how the PARe Aces can open policy and advocacy doors for you and help you plug in at various stages of the policy process. As others have mentioned, the PARe Aces tree can be a really valuable tool for your work, but you should also think about it as an orientation and as a mindset that can help you approach your policy work in innovative, effective, and new ways. Go to the next slide. So on this slide, you'll see some of the photos from our BCR Hill Day in April that Caitlin mentioned, including Von Treese there hobnobbing with Senator Booker. So anytime I want to call it Von Treese, I include this picture. And I should note also that we use the term policy and advocacy broadly here, so we recognize that some of you are constrained on how you engage in advocacy and policy work, but also to note that nearly all of us, no matter what type of institution we work at, can engage in education of policymakers as opposed to lobbying, for instance. So the PARe Aces concept and the tree are really powerful tools for educating policymakers. So it's important to understand that most policymakers do not understand ACEs with any type of sophistication, and that goes beyond just the brain science. Even fewer think about ACEs in the context of community or as the product of systems. So the tree really gives you a powerful tool to visualize these concepts and illustrate the interconnectedness of the health of individuals with the health of communities and the systems that serve kids and families. So when talking to elected officials, it's really critical that you also localize issues for them, and the tree helps you do that. It's important to explain what something looks like in a specific neighborhood, or to show them how their district or the community they represent stacks up against others. These are really the kinds of things that get a politician's attention. And as Sarah mentioned, we also have a mantra here, no data without stories and no stories without data. And this is especially true when talking to policymakers. And the tree provides a tool to both show the data in a compelling and locally adaptable manner with BCR copyright, while also providing you a jumping off point to personalize the issue for lawmakers. So just one example, during our Hill Day, I was with our Cincinnati and Northern Kentucky team, and you see them in one of the pictures at the bottom left of your screen. And so they used the tree to paint the picture of ACEs in their community, but then one of the pediatricians that was with us from Children's in Cincinnati was able to tell a story about one of her patients and how the adversity in that child's life manifested itself both medically in her clinic, but also at his school and in his interactions with the child welfare system. So using that story, she was able to weave in both the brain science of ACEs, but also show how the child interacted with and was served by, or not served by, in some cases, various systems. You can go to the next slide. So you've seen this graphic in Caitlin's slides, and hopefully all of you are busily downloading the template to use, but I wanted to pull it up again to reiterate just how this tool can be so useful in the policy arena. So on the left-hand side, on the first page, you'll notice a few things that are really important when talking with elected officials. So first, they get to see how their state or district compare with others, both within the state but also against national data. Then the graphic makes the connection between what is happening in the lives of individual kids. So in this case, you could think about a child with an incarcerated parent with what is happening in their community, things such as the violent crime rate of substance abuse. So this also provides you with a jumping off point to talk about the experience of a particular child. So again, data plus stories. And then note that you can tailor these graphics to fit the interest of the policymaker you're talking to. So if someone is on the education committee, for instance, you could really lean into school-related data points and use that in your graphic. And then you see on the second page, you can move from painting the picture of adversity towards what the solutions are. And this is a really important lesson in your policy work. It's critical not to just come to a policymaker with a problem. They hear that all the time. I'm sure you've seen some televised town halls. But to have a solution, or better yet, as Sarah mentioned, a really specific ask about what your audience can do to address the issue you've presented. And you can use this graphic to do that. So you can see on that second page that the Oregon team, this was their one of the graphics they used on Hill Day, really laid out the outcomes that would indicate healthy communities. And then they have 3 specific things that they wanted to talk to the policymaker about. So we can go to the next slide. So the PARe Aces concept and the tree are also important tools when finding and working with partners and collaborators. So for most people, policy work is not their full-time job, and so taking advantage of the power of networks and partnerships is really key, and illustrating how you and others might fit into that work and developing a shared understanding of what it is you're trying to accomplish can be really helpful. So the picture on this slide is an exercise our teams have done with NACCHO, where folks physically are connected to others by way of their shared goals or work. So it's really a powerful illustration of how people can see themselves in the work and see their connections to others. So when you utilize the PARe Aces concept in the BCR framework, you begin to have a fuller picture of who needs to be at the table. This can also be a key tool to both map assets in your community or to work in already occurring sectors and to avoid duplication and identify gaps in the policy work. So one example I'll raise up again is from our Oregon team, and as some of you may know, the Oregon foster care system has been fairly troubled for a number of years, but thanks to some innovative and visionary leadership there, as well as some multi-sectoral collaboration, the state's really beginning to turn things around. So Wendy and I were able to do an exercise in Oregon where we used the PARe Aces concept to work from a very specific problem, that being not enough foster care placements that was necessitating placement of kids in hotels, to a model where entities outside of the foster care system could really see what role they could play in addressing both that very acute and urgent problem, but also the underlying causes that were leading to too many kids going into the system and not enough placements for them. So the result of that exercise was some concrete commitments from other agencies with really no direct responsibility to the child welfare system to take on some responsibility to help fix the problem. And I should also mention that the PARe Aces concept can help you internally with trying to get buy-in from your organization. So I think we are all familiar with the challenges of adding new things to our agenda, and we hear often about initiative fatigue, and that's a very real thing, and people want to know why this is better than what they've been doing. And so what I think is really unique about the BCR and PARe Aces model from the policy perspective is it allows entities to see how they might fit into a larger project without feeling overwhelmed about how to solve a problem that just seems too big or too far outside their lane. So we can go to the next slide. So this slide was really just an excuse to put the Schoolhouse Rock cartoon. So I think you all know the song, you know, I'm just a bill stuck here on Capitol Hill. And then, the famous Otto von Bismarck quote about if you like laws or sausage, don't watch either one being made. So the point here, besides humor, is really that the policy path to getting things done is a really winding one that changes frequently, and that you'll very rarely, if ever, end up where you thought you would when you started. So the example I have here, which is a bill I talk about a lot, is the Trauma-Informed Care for Children and Families Act. And I think it's a really good example about how this process works and about how using the PARe Aces and the BCR concept can really allow you both to plug in at various stages in the policy process, but also across subject matter areas. So this bill started out as a big comprehensive bill to address trauma in various ways, and it led to kind of various spin-off projects, including appropriations language, work with agencies, GAO report, and finally with several provisions being pulled out of that bill and landing in the Opioid Crisis Response Act, which actually just passed the Senate last night, and it's now being conferenced or negotiated between the House and the Senate. So for our role, the fact that we came at the problem of trauma as it's defined in this bill from a number of different places allowed us to, one, bring together some really great briefings where we touched on not only the brain science, but also looked at how trauma manifests itself in other areas. So we brought in education experts, we brought in healthcare, we talked about child welfare, we talked about criminal justice reform, and so that sort of outlook really allowed us to expand support for the bill and talk about it with different audiences who might not otherwise have been interested. And one example that comes to mind for me is when we were up on the Hill, we were meeting with Senator Rand Paul's staff, not someone who a lot of us would think about as a champion of this issue, but his staff really honed in on his interest in criminal justice reform, which is very real and which he's been a leader on, and specifically wanted to talk about the impact of incarcerated parents on children, and really was interested in the cash bail system and what it means when a mom is picked up for some minor issue and can't make cash bail and what that means for the children. And so our team in Northern Kentucky was really able to take that opening and lead to a larger discussion about ACEs in Kentucky. And as it happened, Senator Paul was on the Health Committee, which about a week after we were up there visiting, was considering a number of trauma provisions in their opioid bill, and he ended up supporting those provisions. So again, this allows you to interact with what I would call kind of strange bedfellows and with a bunch of different audiences. So I think that's where I'll wrap up. I will just put a plug in, since I'm talking about the Trauma-Informed Care for Children and Families Act, for a letter we're helping to lead, encouraging both houses to include trauma-related provisions in the final version of the bill. So if folks haven't seen that letter and are interested, please email me directly, jeff.hild@gw.edu. And now I'm going to turn things over to Carolyn Brinkman. She's from the Children's Home in Cincinnati, but is here representing an amazing organization, Greater Cincinnati, called Joining Forces for Children. And she's going to talk about how they utilize the PARe Aces framework and the tree to conduct their policy and advocacy work at the local and state level. So Carolyn, take it away.
Thanks, Jeff. Very honored to be here this afternoon and excited to talk to you about some of the advocacy work that we've been doing here in Greater Cincinnati. As Jeff mentioned, I represent Joining Forces for Children, which is actually a collaborative here in Cincinnati, made up of about 50 organizations that are either child-serving or family-serving organizations that have all really come together to talk about ACEs and what we can do to mitigate or lessen the impact of that adversity and stress on our children and families. So you can go to my next slide, or my first slide. to look at what we can do to mitigate the impact of ACEs. Our collaborative, which is under the leadership of the Mayerson Center for Safe and Healthy Children, is coordinating local resources and supports in the hopes of lessening the impact of these experiences for our children. And we really hope to strengthen the capacity of communities and families to respond to the needs of children. So we are very intentional in our message about not only talking about, as Caitlin had mentioned, talking about the ACEs in the university, but then the resiliency factors and what we can do to promote the wellness for our families. So a lot of our advocacy efforts, we always make sure that we give both messages at the same time. We have found that when we only talk about adversity and stress and what's going on with our children and families, and we don't come back with some messages around hopefulness and resilience, that folks tend to feel very overwhelmed, don't necessarily see what they can do to impact the work because it just feels too large. That double message is really important to us. And you can go to my next slide. So what I've tried to depict here is really how we have used the PARe Aces in our advocacy work. And when we think about advocacy, I think we think of it through two lenses. So certainly Jeff shared that we have met with legislatures locally. So we've met with our city council members, our county commissioners, also been to DC and talked to senators and representatives there, and it continued to work statewide, specifically with our Ohio Attorney General and some of our representatives here in Ohio. But when we also think about advocacy, it's not just about the policy change, but also about how do we influence daily practice. So a lot of our advocacy is also just understanding day in and day out what different organizations are doing to serve children and families and how they can see themselves in this work and understand the impact that they can have. So when joining forces came to be in Cincinnati, a lot of the child-serving organizations, whether that was with early childhood or school-age children, were really becoming more and more aware of the adversity and stress experienced by our children, and certainly the amount of trauma that was showing up in schools and in child care placements. And so joining forces initially was really about thinking about those specific ACEs. At the same time, what was happening in our community, however, was that things like the increased number of children living in poverty, the opioid epidemic that was really hitting our tri-state area hard, increased family homelessness, were really bubbling up to be priorities for a lot of our local stakeholders, businessmen, businesswomen, and our legislatures as well. So it was really an opportune time for us to start talking about understanding the adversity in our community and the interconnectedness between that adversity and what we were seeing in regards to the large number of children that were experiencing ACEs. And so some of the things that I've tried to highlight here are some of the adversities that we see in our region. So certainly high rates of children living in poverty, high rates of children with a parent that has been incarcerated, high rates of children that are exposed to violence or victims or witnesses of that violence, and then increased foster care placements. So what we were able to do is really start having the conversation and opening people's eyes to the fact that these things were very interconnected. So for a child living in poverty, the likelihood of them experiencing maybe a drug-addicted parent or a parent being incarcerated or being witnessed to a violent crime increased. Same for those children that experience homelessness in our community. So we were really able to start making those interconnections for folks, which really improved our conversations in our community. And so what we saw was that we started to really expand. So where initially it was social service agencies, child serving agencies that were coming together to talk about ACEs, as we expanded and used the PARe Aces concept, we really started to engage more stakeholders and more community partners in the work because they could really see how the two pieces were playing out differently in our communities, but they were coming from the same spot. So if you go to the next slide. So I could talk to you a little bit about what some of our engagement efforts, what we have done intentionally to use the PARe Aces and engage people in the work. So one of the things that we did within joining forces is develop 4 specific channels So you can see we have an early childhood channel, a school age channel, a healthcare channel, and a local initiatives channel. Each one of those channels is comprised of local stakeholders, community partners, as well as social service agencies that come together specifically around that particular issue. So, for example, within the early childhood channel, which I'm a part, we really focus on what is going on with young children and their families, trying to understand the type of adversity that they're experiencing, and also working really diligently on how do we mitigate or lessen the impact of that by promoting protective factors through strengthening families model. So we really focus on those pieces of the work and use advocacy as a way to think differently about not only what can we change in policy, but what can we do differently in our practice, and how can we share resources across the early childhood system, which is having great impact in our community. We certainly have met with, and as Jeff mentioned, did Hill visits at both the federal and the state level. We continue to have those conversations with local leaders as well, talking about ways that we can influence things in our community. We do quite a bit of speaking engagements. We go to stakeholder groups, we go to statewide conferences, any opportunity that we can get in front of folks to make sure that we're increasing people's awareness of the PARe Aces and what outcomes that is having in our community and how that's affecting our children and our families. We've also made intentional connections with initiatives with very similar focus. So in Cincinnati, for example, there is a group called the Poverty Collaborative, which is working specifically on ways to lessen poverty and address increased self-sufficiency for more of our families. So we work hand in hand with them, talking about adversity and stress on our end, and then how we can work together with them to mitigate or change poverty in our area. And then we've had quite a few local media spots, so it's been really exciting as we have really pushed forward this agenda where we see local news stations often talking about adversity and stress. Bob Shapiro from Children's Hospital, who really helps lead a lot of this work, has been involved in radio spots, newspaper spots, television spots. And so it's really getting the information out there, and you can hear more and more people talking about it. So if you want to click to my next part of the slide, what has happened in the results, some of the results we're seeing, as mentioned, we have over 50 local agencies involved in the channel work. Through our Hill visits, we established an ongoing relationship with Senator Sherrod Brown. His office has done some very specific work around the Trauma-Informed Care Act, and we continue to maintain contact with them, providing information about not only what's happening in our community, but they were very interested in best practice. What would be some of the things that we would recommend when looking at trauma-informed care for our communities? Attorney General Mike DeWine, who's been very involved, Bob Shapiro, as I mentioned before, has really created a fantastic relationship with Attorney General DeWine, and he's just recently increased some VOCA opportunities in Ohio, so increased funding for violence for victims of crime in ways that we can work differently, and is really focused on the protective factors and the wellness of our children in that work, and a lot of awareness around ACEs as well. We have an upcoming gubernatorial election, and Attorney General DeWine is actually one of our one of the people running for governor. And both of our governors our gubernatorial candidates have talked about platforms that address trauma and specifically early childhood. And we also have been working with Groundworks Ohio, which has recently published some resources and information regarding the impact of ACEs and racial disparities. So those are some of the highlights, some of the things that we've seen really come out of our advocacy work as we've continued to increase awareness at a local and state level about the impact of trauma from both an individual perspective and a community perspective on the wellness of our state. And if you want to click to the next slide. Specifically around the early childhood channel, a few things I just wanted to share with you as we think about advocacy and change in practice. So you can see our key stakeholders are really the different initiatives and collaboratives across our region that are addressing a similar population as ours. Certainly at the state level, Groundworks Ohio and the Kentucky Governor's Office of Early Childhood are tremendous partners of ours that we work very closely with. And certainly, locally, our early intervention specialists, as well as early care and education, and early childhood mental health providers are critical to our team and our work. Some recent opportunities for advocacy that we're taking advantage of. One of the interesting things that happened in Ohio recently was they mandated that all statewide home visitors were required to collect the ACE survey, which we were excited about but also worried about at the same time. We've tested some of that in early child care programs and certainly have worked with collection of ACE information from families directly and have found that there are specific strategies that are really needed in order to be able just to collect that information. So one of the things that we're doing is working very closely with home visitors in our area to provide the resources, best practices, and supports that they need to be able to go out and administer that type of screen. The VOCA grant is an area where we have written specifically requests into Ohio to receive some additional funding to support practices that we can bring into early childhood programs, child care provider homes, to support the victims of abuse that are often in those situations. Our local Preschool Promise and United Way have led some family-centered learning communities, which is really endorsing the holistic and wellness platforms across our community. We've been very integral in informing that work and influencing how we think about family-centered practice and how we think about specifically supporting families who have experienced trauma who are part of that work. And then next week, we have an upcoming governor forum on early childhood, so both gubernatorial candidates will be presenting their early childhood platforms to a group of us in Columbus, and we will be there representing Joining Forces for Children and posing some specific questions to both in regards to how they plan to continue to address trauma in their platforms for early childhood. So, a lot going on, very excited about that, and that's my wrap-up.
Well, thank you so much, Carolyn. We are so excited to have, obviously, your team, Joining Forces for Children, Alive and Well Communities, as well as our teams in Texas, Oregon, and here in Washington, D.C. This is a time where if you can type in for some questions, we certainly have time to answer your questions. One of the things I wanted to say off the top there is just a bit of housekeeping, is that every tool that we have shown you will be available or is available currently on our website. They were uploaded to the website right before the webinar, so the templates, the infographics are all available right now. This webinar has been recorded, and so it will be posted on our website as well later on this afternoon, as well as the webinar slides. So all of the slides that have been presented will be available to you as well for download. So one of the questions that's come in really is for our Alive and Well Communities team. So Sean or Von Treese, if you're there, if you can answer a couple of questions that were directed to your team, first of which is, what counties in Kansas are involved right now?
So currently we're working primarily with the greater metropolitan area in Kansas, the suburban areas of Kansas City. So right now we're looking at Johnson County as well as Wyandotte County.
Okay, thank you. And then there was a second question, and maybe Von Treese could answer this. Where are the ambassador trainings taking place in St. Louis, and how might one become involved?
Yes, our ambassador orientations right now is at one of our local community centers, and we post those up, the registration links, monthly on our website. So individuals, all they have to do is just register, and it's absolutely free.
Okay, so there's another question that, if you can go back to that, Caitlin. We had it from, let's see, it looks like from Denise. It says, how are our advocates using the PARe Aces to educate and motivate legislators to urgently cease enforcement of policies that cause harm, such as ceasing funding for the war on drugs, in addition to writing future humane and trauma-informed policy? So I'm going to punt to Jeff and see if there have been any success stories or barriers with regard to addressing those issues.
Yeah, so I think one of the powerful things about the PARe Aces tree is that it helps you to explore systems that aren't working. And I think the questioner refers to a couple of those in their question. And so, particularly at the local level, we spend a lot of time thinking about how juvenile justice, for instance, is working or is not working for vulnerable kids, about how community police interactions are working or not working for the communities we work in. And so I think that's the perspective that we and also a lot of our teams bring to the work. So, it's both about reforming the imperfections in current systems and also thinking towards what an actual trauma-informed system or child-serving system would look like. So I'd welcome others to jump in as well. I'm trying to think of a specific example from one of our teams around this war on drugs question. I think it more so manifests itself around parental incarceration and criminal justice reform. But
that's correct. That's correct so far. I want to move to a question from Ava Powell, who posed to us, do any of you have health insurers participating in your programs, and if so, what role do they play? And so the answer to that would be yes. Recently, Oregon Health Authority, which is the Medicaid Managed Care Authority in Oregon, is at the table with the team that is working to address the foster care crisis there. And so again, being very strategic, and maybe, Jeff, if you could talk a little bit about how we leverage crisis to get some of those state-level agencies, as well as federal legislators, really engaged in our work, has also been one of the tactics that we've been able to capitalize on. But there in the foster care crisis, as Jeff has said earlier, on the heels of a scathing report with regard to what was happening with children being held in hotels and things of that nature, it became an opportunity for the state-level agencies to come to the table with some of our community providers to address these issues. But I think it would also be interesting, Jeff, if you could speak to how Oregon Health Authority has also incentivized trauma-informed practice there through the Trauma-Informed Oregon work.
Sure. So one of the examples in Oregon we like to use is Trauma-Informed Oregon, who was created under the Oregon Health Authority, which is their state healthcare Medicaid agency, to provide trainings all around the state. And it's not so much on what it means to be trauma-informed in practice, but on kind of the concept of trauma and how it shows up, and really creating that shared understanding. And so that's really been a powerful tool. And their mandate is really to work with state agencies. So I think slowly but surely all levels of the state bureaucracy are getting this training. And again, that was funded directly through the Oregon Health Authority there.
Well, yeah, so the next question, I think, Von Treese, this is probably best for you. This is a question from Raquel Williams-Jones, who asks, what are the calls to action for residents who are under this fire and chronic daily stress? So how have you been able to get the community members really involved in this work when this is their day-to-day experience?
Yes, so we have a group of residents that we refer to as our community consultants. They are folks that live in what is referred to in St. Louis region as our Promise Zone area, which is a federally designated area, an area of disinvestment, of course. And they are living a day-to-day experience with community trauma and individual trauma. So we've been able to hire them. We've received a grant. We've been able to hire these residents to hold what we call community empowerment workshops. So the trainings that Sean does, he does them usually or traditionally with the service providers. And we knew we had to create content or trainings for folks in the community who are receiving the services, who can understand this common language as the service providers are getting. And so we built out the community empowerment workshops, and we trained residents, and we pay them to deliver these workshops in their neighborhoods of choice. and most of them chose neighborhoods where they live. Now, that work has evolved this summer to now we don't just have ambassadors throughout our region. We are working to build what we're calling place-based ambassadors. So, for example, we have a municipality here in the area of Jennings, Missouri. We have a community consultant who has been working in Jennings for the past year. She lives there, and she's been doing these workshops. Well, now she has this strong following of residents who are really interested in taking this awareness and actually moving into action and addressing some of the things that they're seeing in their soil. So I hope that makes sense, but that's how we're doing this. Kind of happening organically. The residents have saw something in this content and really have connected with the content, and they really feel like their neighbors, their families, their friends, everyone needs to hear this.
Thank you, Vontrice. The next question is actually, I think both you and Carolyn could probably speak to this, but I'll go ahead and let you speak first. The question is from Brad. What kind of representation has the business community had in the BCR communities? Are they at the table for planning, implementation, and/or advocacy efforts? And I think it would be helpful, Vontrice and Sean, if you guys could talk about how the Resilient KC work started and where that was actually headquartered, because I think that's one of those unlikely suspects that could really be instructive to our other communities.
Sure. I think that's a fantastic question, how the business sector really needs to be a part of this movement. And the work is much more evolved on the Kansas City side of our region, where in Kansas City, Resilient KC, which then transformed as part of our larger Alive and Well communities, was actually hosted by the Chamber of Commerce in Kansas City. So really connecting that in order to really make sure that our community has those economic opportunities and that we're building them and that we're economically well, we have to understand greater well-being as a whole and understanding the role of trauma and toxic stress as we try to really change the fiscal infrastructure of our community. And so the Kansas City Chamber of Commerce played a crucial role in helping to facilitate that message as well as build those relationships with the business community to help them understand that trauma is not just a personal issue, it's not just a community issue, but that in order to create an alive and well community, the business community has to be a partner in this process.
Thank you, Sean. Carolyn, do you want to speak to how business interests in Cincinnati have been engaged?
Sure. I think that when we talk about issues like the increased number of families living in poverty, certainly the opioid epidemic, those issues have come, I think, in the forefront for many of our business leaders. And so they have certainly been involved in recognizing the issues within our community and certainly recognizing how that is impacting them overall. And I think they are just starting to dip their toe into the work with us. They are certainly involved in more of the poverty collaboratives and the preschool promise and some other aspects of the work. So they're recognizing the need for their involvement, but I think we're really in the infancy stages of that right now in our region.
Thanks, Carolyn. Caitlin, you had a...
Sure. Hi, everyone. We've also been receiving several questions from folks asking if they can connect directly with our BCR sites within Dallas, Oregon, MoCan, et cetera. And what we would recommend is if you go to our website at go.gwu.edu, you'll see that we have several what we call site snapshots. So they're 2 to 3 pages that give an overview of the site-specific work that's being done. And at the bottom of those snapshots, you'll see a contact within each site with their email address, and we encourage you to reach out to these site leaders directly to see how you may get involved.
And just a clarification, that's go.gwu.edu/BCR.
Thank you, Sarah. Sorry about that.
One note, I do see that someone, it looks like Tommy is looking for contact with the Dallas team, and we will be hosting our BCR Town Hall in Dallas on October 4th at the downtown library from 3:30 to 5:30. That is open to the public. And there are a number of community participants who are coming not just from Dallas, but also from Austin, San Antonio, and Houston. And so I would encourage you, if you are in the Dallas area on October 4th, 3:30 to 5:30, the downtown Dallas Public Library, please join us as we meet in person. All of our teams from across the country will be at this meeting, and we'll be talking specifically about the Resilient Dallas initiative. Are there any other questions?
I believe that may be it for now.
Great.
Yep.
Well, we don't want to hang on to you. It says, oh, so there is an important question. You know what? This one should be answered. From Joelle around how do your collaborators, how have they been funded? And so this is a question that we get quite a bit, and I think it's really important for us to address, so thank you for that question. Is that we don't fund our sites. What we really are focused on is the long-term sustainability and understanding that we don't ask teams or participants or organizations to do work that is outside of their mission. And in addressing these community adversities, this is the beauty in having the collective effort, because all these issues that we address and as you see are depicted in that tree are really a part of the mission and the work of a number of different organizations. So it's the idea of harnessing what we're already being paid to do, what we already have invested as far as resources are concerned, and working much smarter and also much more efficiently because we have collaborated in an efficient way. So there isn't an ask as far as additional funding to do the BCR work. In fact, what we like to tell people is that, you know, it's our job to really help you maximize what you already have at the table, and if we're doing that properly, then we're able to uncover where there may be some gaps in spending or resources so that we can, if we're going to make asks for additional funding, they are very targeted and well-researched asks and not just a general ask. And so the funding for this program is really for us to work with the teams, provide the strategic technical assistance, and develop these tools that we're sharing with you today. So it doesn't look like we have any other questions, and so again, everything that we have shared with you today as far as the infographics and where to source these data, all of our tools, the site snapshots, they're all available on the website. Please follow us at ResilNation for up-to-the-minute updates on our work, our resources, our stories from the field. And again, if you're in Dallas, we welcome you to join us at that town hall meeting. You'll see plenty about that on our Twitter feed. And thank you so much for joining us today, and thank you for all you do to build a resilient nation.